She's a 45-year-old lady with 3 children. She came to see me because of bleeding. And when we did a diagnostic curettage, we found that she has a pre-malignant condition. So she has to have this treated, otherwise this can become cancer in at least 40% of the cases. So I scheduled her for a robotic hysterectomy. The reason why I chose this way of doing the hysterectomy for her are manifold. One of them is that she's had 3 previous cesarean sections and an ovarian cyst operation before, which means she has had 4 surgeries before in the abdomen. We will be expecting a lot of scarring inside the abdomen where things will get stuck together due to adhesions. With the robotic system, we can see very clearly and we can do the incision very precisely, which makes the surgery safer for her. In my view, if a patient has to undergo hysterectomy, they should opt for a robotic-assisted surgery in terms of the numerous benefits that we can get from it. Firstly, the incisions are smaller, up to 8 millimeters in size, and this provides a better cosmetic effect and is also much less painful. The patient also can be discharged much earlier. Some of them go home the following day and they can go back to normal activities faster. Hospital stay will be shorter. And another thing is the experience of the whole admission and the surgery is better. Patient feels happier following the surgery. I noticed from my observation of patients who undergo conventional surgery compared to robotic-assisted surgery. And there's also less bleeding from the surgery because of less tissue trauma, as the incisions are all more precise. There's less trauma to the tissue, and when there's less trauma, there's also less bleeding. So the need for blood transfusion is much lesser compared to traditional way of doing the surgery. And the amount of pain relief that we need to give is also much less, as there's minimal pain. So they will get less side effects from analgesia. Some of the pain relief medication can cause drowsiness and vomiting. So we avoid all these sort of things. As for the surgeon's perspective, we find it much easier to use this system to do the surgery because we are seated in a very comfortable position when we do the surgery. It's very ergonomically, it's very advantageous to the surgeon. We are seated and we are looking down straight into the Zero viewer, which is a 3-dimensional image that we get of the surgical site. We also can get up to 10 times magnification with this stereo viewer. When we look down the stereo viewer, we don't see anything else except the anatomy that we are operating on, which means we are totally immersed in our surgery. There's no distraction from the outside world, so we are totally focused.
This cancer was just a few centimeters from the anus, and traditionally this sort of cancers would mean that the entire rectum and anus would have to be removed, and the patient is left with a permanent colostomy, meaning he or she will have to wear a stoma bag for life. With the enhancement in optics and instrumentation, the system allows us to dissect very low down and preserve the anal sphincters, which is what is important if we want to try and preserve the continence of this patient after surgery. So as with most robotic surgery, the recovery was very rapid, much faster in fact than what we are normally accustomed to. Normally, even with laparoscopy, we find that the recovery is quick, but now with robotic, it's even faster. And some patients even ask us after surgery whether they've had the surgery because they felt that they didn't feel much discomfort at all. So, and likewise, it was the same with this particular patient. She did not have a colostomy bag. We managed to join the intestines, anastomose. After removing the cancer, we managed to join it with the help of Da Vinci robotic surgery. to join it very low down. So she did not need to have a stoma bag, and not much pain, and definitely not much bleeding. She did not need any blood transfusion at all, and even in terms of post-operation analgesia, all she needed was some paracetamol, and she was back to eating and drinking. Well, drinking first, I suppose, the next day, and eating 2 days after that. If I have it my way, I probably would want to do everything with the robot, because we've seen what difference it can make. We are able to preserve a lot of function nowadays with Da Vinci, without jeopardizing the cancer clearance, without jeopardizing the patient's safety. So Da Vinci robotic surgery is definitely going to be a game changer.